Hello and welcome. Today we're diving deep into a specific type of heart disease, coronary vasospasm, also known as Prinzmetal's angina or variant angina. This condition can cause unexpected chest pain and discomfort, and understanding it is crucial for effective management. So, what causes coronary vasospasm? Unlike typical angina caused by blockages in the arteries, vasospasm is a temporary narrowing of the coronary arteries due to a spasm of the smooth muscle within the artery wall. While the exact cause remains elusive, several factors are known to contribute. These include smoking, exposure to cold temperatures, emotional stress, and the use of certain drugs, particularly cocaine. Other possible triggers include hyperventilation and even, rarely, exposure to certain industrial chemicals. Now, let's look at the pathophysiology. Imagine your coronary arteries as vital pipelines delivering oxygen, rich blood to your heart muscle. In coronary vasospasm, these pipelines suddenly and temporarily constrict. This constriction reduces blood flow to the heart muscle, causing ischemia, a lack of oxygen. This ischemia is what triggers the characteristic chest pain. The spasms can occur even in coronary arteries that are otherwise healthy, but are more likely to occur in arteries that have some plaque buildup, a condition known as atherosclerosis. The duration of the spasm can vary from a few seconds to several minutes. If prolonged, it can lead to serious complications. In terms of epidemiology, coronary vasospasm is relatively uncommon compared to typical angina. It tends to affect women more often than men, and it's more prevalent in people of Japanese descent. The average age of onset is around 50 years old, although it can occur in younger individuals as well. Its rarity makes gathering exact statistics challenging, but it's important to be aware of its existence, especially if you experience chest pain that doesn't fit the typical pattern of angina. The hallmark sign of coronary vasospasm is chest pain, often occurring at rest, particularly between midnight and early morning. This is a key differentiator from stable angina, which is usually triggered by exertion. The pain can be severe, described as a squeezing, crushing, or tight sensation. It may radiate to the left arm, shoulder, neck, or jaw. Other symptoms can include shortness of breath, lightheadedness, nausea, and sweating. Some people might also experience palpitations or even fainting spells during a severe spasm. Diagnosing coronary vasospasm can be tricky, as it doesn't always show up on standard tests like routine EKGs during a doctor's visit. The gold standard for diagnosis is coronary angiography with provocative testing. During this procedure, a medication, typically acetylcholine or ergonovine, is injected into the coronary arteries to try to induce a spasm. If a spasm occurs, it confirms the diagnosis. Ambulatory EKG monitoring Holter monitor can also be useful for detecting changes in heart rhythm that occur during chest pain episodes. Other tests, such as blood tests to rule out other causes of chest pain, may also be performed. While coronary vasospasm doesn't neatly fall into distinct types, in the same way as other heart diseases, it can be classified based on the presence or absence of underlying atherosclerosis. Some individuals have vasospasm in arteries that are relatively clean, while others have vasospasm superimposed on existing plaque buildup. The presence of underlying atherosclerosis can influence treatment strategies and prognosis. The primary goals of treatment are to relieve symptoms and prevent future spasms. Medications are the cornerstone of management. Calcium channel blockers are the first-line treatment, as they help to relax the smooth muscle in the arteries, preventing them from constricting. Nitrates, such as nitroglycerin, can also be used to quickly relieve chest pain during an episode. In some cases, long-acting nitrates may be prescribed for prevention. For patients with underlying atherosclerosis, medications like statins and aspirin may also be recommended. In rare and severe cases, a procedure called percutaneous coronary interventions, a PCI, with stent placement may be necessary to open up a severely narrowed artery and prevent future spasms in that specific location. Preventing coronary vasospasm involves identifying and avoiding triggers. Quitting smoking is absolutely crucial. Managing stress through relaxation techniques, such as yoga or meditation, can also be beneficial. Limiting exposure to cold temperatures, especially sudden exposure, is another important step. It's also essential to avoid recreational drugs, particularly cocaine, and to discuss any medications with your doctor that might potentially trigger vasospasm. The prognosis for coronary vasospasm varies. Some people experience infrequent spasms and can manage their symptoms effectively with medication and lifestyle changes. Others may have more frequent and severe spasms, which can increase the risk of complications such as heart attack or arrhythmias. Regular follow-up with a cardiologist is essential to monitor the condition and adjust treatment as needed. Recent research is focusing on identifying genetic predispositions and specific biomarkers that can help predict the risk of vasospasm and tailor treatment strategies more effectively. Scientists are also exploring novel therapies that target the underlying mechanisms of vasospasm, offering hope for improved outcomes in the future. Thank you for watching.